Good afternoon. Dr. David Kemp here to give another video. Today we're going to discuss asthma. All right, now, as an athlete growing up, my father a chiropractor, we were exposed to a lot of asthma kids that get out and exercise and they develop their asthma, they pull out their inhaler. My dad would go talk to their parents, say, hey, maybe we should give this kid a try and we'll do some adjustments, see if we can help with their asthma. Lo and behold, 4 weeks later, the inhaler's gone and these kids are better athletes. Now, the irony here is some of those kids, they're still patients of mine now, and when we talk about their asthma, they totally forgot they had it. So, the cure for asthma, now, we don't like to say a cure a lot, but exercise-induced asthma is pretty curable. Now, if we look at types of asthma, the two most common that we deal with are exercise-induced asthma and allergy-induced asthma. Now, there's other types, but they kind of fall under those two. Now, when we look at exercise-induced asthma, this is anatomically based. So if I'm out exercising, I got to breathe. To breathe, that oxygen's got to go in my lungs have to expand. Well, my lungs only expand as big as my rib cage, and my rib cage doesn't move. That's an anatomical variant, all right? Much like blowing a balloon up into a Coke bottle. The balloon's going to get as big as the Coke bottle. But if that Coke bottle were to break, more oxygen, you see? So if I have an exercise-induced asthma, and I'm in bed and my ribs aren't moving, then I'm going to have a harder time at night, right, getting more oxygen to sleep through the night. So there's other aspects that will affect sleep, right, digestion. Now, the allergy-induced asthmas, these tend to be more food, right, autoimmune. So if we look at they're eating something that's creating the mast cells, and these mast cells dump all into their bronchial trees, so they get these little holes and they can't breathe into, and then you remove the allergy, they get better. Now we see a lot of that's food, but it could be some kind of spirochete or something floating around in the air, we're not quite sure. But that's what tests are for. Now the main thing is if you have a kid that is diagnosed with asthma, the easiest thing to do is get them to a chiropractor, get some rib adjustments, a couple of adjustments, and see if they get better. Measure their chest expansion, measure their oxygen saturation, see how much oxygen's in their blood. Take this little tape measure, wrap it around their chest and see right upon exhalation and inspiration, do we get a 4-inch difference, do we not? If we don't, I do this and when I measure people, some of them have none, not 1 inch, none. That's scary. Then we get into some treatment, we see improvement, we see it here, and then they feel the difference. But if all you're doing is an inhaler and you've never experienced that because you've been scared of manipulation, now only 4% of the population go to chiropractors, that's scary. That's a lot of asthma drugs out there that don't need to be used. So if this is you, at least get to a chiropractor, give it a shot, right? You don't have to go 3 times a week to the day you die. If you do, change chiropractors, okay? So give it 3 or 4 visits. If you don't see any help, then get to a functional neurologist, somebody that knows a little bit more, and they can help you further, okay? Hope this helps. Have a great day.